What is going on, y'all? My name is AlwinTheSheriff, aka AlwinTheSheriff of all things innovative, and we're about to get messy with the tech. And I know that y'all have been hearing a lot about Elon Musk lately and the latest situation going on with the implant inside of one of his patients' brains. So that's exactly what we're about to talk about today. We're about to get real messy with this story. But first, before we dive into that, let's have a listen.
I see dead people. Aye, monster on the beat, ho, Debo, any rap nigga, he a freak, though. Man down, call like Amber Lambs, tell him breathe, bro. Nail a nigga to the cross, he walk around like Tizo. What's up with these jabroni ass niggas trying to see Compton?
That's enough of that. Don't make me keep on playing this track the entire time. I will keep on cranking it. This man Kendrick is crazy. It's like no. But for some of y'all who aren't in the loop, basically, just the past couple weeks or so, this man Drake has been going at it with Kendrick. I think the beef is officially over now, but when it comes to winners, I'm gonna have to vote Kendrick on this one. This beef was insane. It was definitely one for the culture, bruh. Kendrick did his thing. They both did their thing, both incredible artists, but I'm gonna have to give it to Kendrick. The lyricism, the musicality, everything. I loved it. It was really freaking awesome. My thing is, at the end of the day, I'm really... The conspiracy theories have been driving me crazy around this. I'm not gonna lie, that's probably been the biggest thing. I think that what I do like about beefs is that you get the opportunity to see artists go at one another and try to see who can best the other's lyrical ability. But with this beef, it got kind of weird. You know what I'm saying? Because now people are just coming out of nowhere with just conspiracy theories about their lives, especially Drake. Mostly Drake has been getting the heat of this. It's like, yo, dudes have been saying, yo, I don't even think Drake's kid is Drake's kid. I think that's Kanye's kid. I'm like, what? I can understand Nick Cannon, but Kanye? Like, that's crazy. Anyway, enough of that, y'all. Let's go ahead and dive into another episode with Messy with the Tech. So you want to know what got real messy? Elon's brain chips in one of his patients on Wednesday. It seems that after just a couple weeks of using the chip to play Mario Kart, 29-year-old Nolan Arbaugh, Neuralink's first patient, had a chip malfunction. The connective threads in the chip within his brain used to deliver signals from his brain experienced a retraction, which in turn reduced the signals that could be captured by the chip. Now, there's no word on how this has immediately impacted Nolan, but the company did manage to improve the signals coming from the chip by simply modifying the algorithm. So good on Elon's team for being able to do that. But if everything continues to play out well, the company wants to implant 2 more patients within the next couple months and then reach 10 people total by the end of the year. That's kind of insane. I'm not gonna lie. But my biggest thing is, I wonder if that thing ever gets itchy. I think that's my biggest concern at this point. Like, yo, all I gotta say is I hope they connected like a mini robot arm to that chip or something, just to make sure that if those patients do start feeling something, like they don't even have to start reaching for their brains, bro. They just might have to we just might have to go back to a point where, you remember during COVID, they used to stick those little swabs up your nose so you can so they could get samples. But sometimes those swabs felt like they were touching your brain. They just might have to go back to COVID times and start doing that for the patients, because that's the only way they're gonna get them out of that funk. That's all I gotta say. That's my biggest concern, bro. I don't care what anybody says. That thing must be getting itchy, especially with the thread retraction, which is exactly what we're gonna continue to expand upon. So here's a little bit of history for y'all. Basically, Elon Musk founded Neuralink back in 2016, along with a group of scientists to study and develop brain implants that could have an impact on individuals with physical and neurological complications. Now, the company started officially building their implant in 2019, and in 2020 showed off their surgical robot that would be responsible for ensuring safe implantation into the brain. Now, 2021 got even more interesting, as we got to witness a monkey from one of Neuralink's testing sites playing ping pong. Wait, no, not ping pong. The game Pong, using the implant. That's kind of crazy, because as we continue to get into this episode, I'm going to talk about some of the failed experiments and some of the atrocities that we've been... atrocities is a very strong word, but some of the situations that have been occurring with the animals at these labs, we're gonna get into it, but it's kind of insane how, for this particular monkey, Elon Musk was able to show off this animal playing Pong using the implant that was put into the monkey's brain, and he rewarded he rewarded the monkey with a smoothie. And it's like, this man Elon was really like, yeah, I mean, I know we ended up accidentally like killing tons of monkeys, but hey, at least we got this one to survive and we gave him a smoothie. Like, yo, that's crazy. I don't know. Like, anyway, we're gonna get into it because it was just insane to me thinking about it. Like, and I don't know, bro. I don't know. I'm not sure you could ever put one of these implants in my mind. I don't care how many fruit smoothies you give me, bro. I'm just not doing it. That's insane. I mean, I don't know. I guess it depends on what's in the fruit smoothie. You know what I'm saying? You probably put in some strawberries, say a couple bananas. Anyway, we're going off topic. Let's keep on going. Yo, so basically, in 2023, they finally received approval from the FDA, and they started recruiting patients with, and forgive me if I'm not saying this right, I feel like I've been practicing this word ever since yesterday. It's driving me crazy. Everybody, please just let me know if I'm saying this wrong. Quadriplegia. Quadriplegia. All right, bet. Yeah, I've been practicing this all day since yesterday. Obviously, it hasn't been helping. But that's my best attempt. Let me know in the comment section if I said it correctly. And here we are in 2024, where the company saw its first patient, Nolan Arbaugh, receive this implant, and he seems to be doing pretty well, at least based on what we know so far. The company hasn't released any additional information on how, Nolan is doing ever since these retractions occurred in the threads in the chip in his brain. But I mean, I'm sure they're gonna say he's fine. I mean, it's not like they're trying to. Yeah, I'm sure he's fine. I'm sure everything's gonna work out for the best. You know what I'm saying? Praying for him if anything, if anything serious occurred from this, but I'm sure he's absolutely fine. Now let's get to the real conversation. Yo, when I put this implant inside of my brain, I kind of have a tendency to cringe at this type of technology being implanted in my brain. I'm not gonna lie. I mean, my thing is, y'all know me, I'm a tech enthusiast, all right? Part of me says yes because I'm so eager to see what the future holds and what we can accomplish, but the level-headed part of me says no because I don't really know how much this has been studied. I don't know what it could do to my brain. I don't know it. You know what I mean? I'm an enthusiast. I'm a person that likes to explore, to learn, to try to understand, to see how these technologies are going to continue to impact us. But that's the thing, right? Is that we haven't seen how this is going to play out in the long run. And I don't want to be a guinea pig for this experience. And I don't even want to call the patients guinea pigs. That's very rude. So that's probably the wrong word to use. But I just think it's important to understand how these technologies are going to impact us, impact our biology, impact the way we, draw in information and communicate with others and interact with our environment. I think things like that are extremely important. But for someone like me, I don't know if I'm willing to take this amount of risk with this particular type of technology. So I don't know. That's just me. I kind of cringe again at how integrating this type of technology like this into my body would work. I mean, I've seen different types of people integrate, technology at certain degrees. You know what I mean? Some certain people have implants inside of their hands where they're able to access their vehicles and things of that sort. And that's something we'll probably be able to get more into as this, episode continues. But I can honestly say for me, I don't know if I can do it. I just feel like it's a bit of, it's a huge risk on my part. And it's just the risk reward just seems a bit off to me. I don't know. Let me know what y'all think in the comment section, whether or not y'all would probably want to put one of these in your brains. Because I'm telling you right now, there just might be some mind control involved. That's another thing. What makes you think that, Elon Musk probably didn't start this company just to try to mind control people. You know what I'm saying? What's to actually stop him from using the technology to take over the minds of every single person on this planet as soon as he implants that chip? My thing is, I know for a fact that Elon Musk is an accelerationist. And this is a conversation that we're going to get into again as we continue. Actually, no, let's have this conversation now. I think that Elon Musk is an accelerationist because we see how quickly he's trying to move with his endeavors in his companies, like the technologies, whether it's like, Neuralink that we're currently seeing right now, how quickly he was able to get his first patient to, test trial something like this, from, Neuralink to him trying to get us to Mars, you know what I mean, with his space company. Like all these things he's doing so quickly, but sometimes at the expense of others, which is my criticism. But I think that, the pace at which he's moving makes him an accelerationist. Now, a question of whether or not I support accelerationists, part of me wants to, because I feel like we're moving at a pace where we need to be able to do all these technologically advanced things just so that, we could solve issues like climate change with artificial intelligence. But my thing is, I have criticisms about the type of technology we use and also the people that are being harmed in the process. So for me, I can't tell you that I'm an accelerationist. I personally have problems with some of these. I'm not sure if Peter Thiel's an accelerationist, Mark Andreessen's. These are just some of the names off the top of my head. But personally, I don't know. I've just always taken issue with it a bit. I'm a tech enthusiast. I love tech. I love science. But part of me sometimes feels like we need to be careful about the pace at which we're moving and, the type of technologies we're using and how it's impacting people. So that's why I personally like to kind of take my time with these things. That's how I kind of like to view things. So again, just the question of whether or not I believe in this technology. Yeah, I definitely think that this technology could be extremely useful, for people, who have unmet medical needs. And that's literally what Elon Musk's website says on Neuralink is that, starting out, this technology wouldn't be for everyday people like you and me, obviously, because, we can still move around and we can still interact with, things in our environment using our limbs. But this technology is for people who have, unmet medical needs, people who are, people who have quadriplegia, people who, don't have the ability, to move around as well as other people and interact with their environment and whatnot. And, I think I think technology like this has the ability to greatly help those people under a variety of different circumstances. But my biggest thing is that I'm not sure how much good this technology would do for people like you and me, only because I think we live in a society where people constantly want more and they're pressed to feel like they have something that's better than what other people have, which makes things difficult. So, you got people who just always want the next best thing. Like, ooh, I got this implant. Ooh, I got this implant in my hand. I can remotely open my car. Ooh, I can do that. And it's like, we don't understand the repercussions of this. And yeah, I just feel like we're just in that fast-paced society where everyone just wants to do better than everybody else and have something that's better than what the other person has. And that's where it really becomes a concern for me, because we really have to take our time and study this and how it's impacting the body. And then you have people who are in dire straits, have dire needs, where that's one thing I can applaud Elon Musk on, given, how he changed his company's mission, change the company mission for Neuralink in terms of whom he's trying to provide this technology to, because it's like, these are the people that we're going to work with first, and then we're going to take our time, see how they manage with it, and see how over time this is going to impact people overall. So that's something that I can mess with. The real conversation is, do I believe in the transhumanist movement? Listen, bro, I've been thinking about this for a while. Again, we have the opportunity to obviously evolve with technology being integrated into our bodies. That's basically what transhumanism is. It's people that believe that, tech, and machines should be integrated with the human body so that we can advance as a species, to be able to survive space travel, access information. And I don't have a problem with any of that per se. It's just the rate at which we're adopting it, and the particular reasons for which we're adopting it over time that concern me. So I feel like once that gets addressed, then, I can determine whether or not I want to become, part of this grand movement where I feel like we need this technology to be able to grow and ever evolve faster and accomplish amazing things. That's all it really comes down to. One question I really want to address before I try and cap off this podcast is basically, whether or not this company's track record is going to harm, harm its chances in the long run of being successful, or harm the way people already see it. I don't know if people are privy to the fact that, during Neuralink's operations, they have harmed over, I think, up to about 1,500 animals so far. I think those are the number of animals that have passed away. They've harmed tons of, I don't know how much the public is aware to that, but a variety of different committees, from the Physicians Committee for Responsible Medicine, they issued a statement for, Elon Musk to, start using non-invasive BCI options before he even started working on the implant. I think that, couple that with the fact that some founders have left in the past, because they themselves have been concerned about, the direction in which this company is moving and how fast it's moving. I think if you couple all those things together, I think it's going to be hard for Elon Musk to be able to establish, that level of trust that he once had with the public and with committees. And my thing is, it's just going to take some time. He's going to need to be able to build that back. He's going to need to be able to prove to people what this company is positively trying to do for people, and he's going to need to be able to prove what exactly people will gain from, adopting this technology, deciding to put this into their heads. Because, listen, man, this is just off the bat, this technology is pretty freaky, so, we got to be careful in that regard. Just some final thoughts. Again, I think it's going to take Elon some time to kind of reestablish that trust, given what the company's been going through. I'm not sure how much the public is in the know about animal trials and things of that sort and the exodus of founders, but he'll have to do his best, again, to convince the public that this technology is going to be safe, that his company is going to be in good standing moving forward, and that he needs to be able to convince how this technology is going to improve their lives. Me personally, again, like I said, I know this technology has the ability to potentially impact people's lives in a positive way. I'm not sure how much of an impact I want it to have on mine. I'm just, I just want to stay away from this for now and see what's going to come of it. But I think it's really interesting. I think it's very powerful. And we're going to see how this technology is going to continue to impact people in the future. Thanks so much again for tuning into this episode of Getting Messy with the Tech. Greatly appreciate y'all. Remember, you can find Messy with the Tech, which is available on all podcast hosting sites. Check it out. Doesn't matter what it is. We're everywhere. Make sure you follow us on IG at Messy with Tech. Make sure you follow us on YouTube at Getting Messy with the Tech. If you're watching this on YouTube, listen, leave a like. Please subscribe. Leave a comment in the comment section. Let me know whether or not I even pronounced the words that I used today's podcast correctly. Like I'm not much of a linguist. Just let me know. You know what I'm saying? Give me your thoughts on a variety of different things. Some of the things in this episode I didn't get the chance to get to, the reasons why there was a retraction in the threads in the implant that was in his brain. Maybe you can lay out your own reasons as to why that occurred, in the comment section. I know the company's talking about how there might have been some air pockets, but please leave your thoughts. Let me know what you think. And thanks so much. Really appreciate it. We just got messy with this one, and we'll continue to get messy in the future when we come right back at you. Peace out, y'all.